And up next, we have another insightful presentation waiting for you right here that we will explore the intersection of healthcare and technology with the presentation of Professor Wang Jaw-Yuan. Please welcome.
Và tiếp theo chương trình chúng tôi xin được trân trọng giới thiệu giáo sư Vương Triệu Nguyên, giám đốc Bệnh viện Đại học Y khoa Cao Hùng sẽ chia sẻ với chúng ta bài thuận luận về tích hợp trí tuệ nhân tạo trong y tế. Xin mời giáo sư.
Xin chào again. So the topic I want to talking about is the implementation of the artificial intelligence in healthcare system in Taiwan, also in our hospital. So this is my speaking outline. So let me a brief introduction of the University Hospital. It's 70 years of cultivation, and it's the first Taiwan private medical hospital established in 1954, and also the first private medical university. And we founded in the 1954 years, and we were from a very small medical school, and gradually increasing to the first private medical university in year 1999. So right now we have 7 colleges, 2 departments, and we have a full-time teacher, and also have a student over 6,000 per year, and the student-teacher ratio is about 12.75, and we have a master class, also a postdoctoral degree program, and also a doctorate class in our university. So we are the only hospital in southern Taiwan. We have a complete medical system, cover medical center, regional hospital, and district hospital. We also pass 3 times the JCI accreditation in our hospital. So we were from a very small hospital, about 60 beds in 1957, and gradually increased. This is a free hospital, the university in right now is 1,720 beds. We also running other affiliate hospital. We have since year 1998 till year 2025 a new hospital in Kaohsiung and Kaohsiung area. So we have accreditation of JCI since year 2017. So today I was talking about how to driving digital transformation through technology, and another issue is ESG. So we know that the sustainable goal, development goal in the world, that we have many we have implemented ESG pioneer in the sustainable healthcare blueprint. So it is the KMUH Future Ready Readiness Plus. Well, based on the 2 parts, the first is digital transformation, the second is green transformation. So we propose the six strategy pillars and also top key objectives. We have integration. We want to operation the transformation for the performance optimize. So we have data intelligence, also streamline healthcare delivery. About the innovation, I think the important is the talent transformation and the digital empowerment. So we enhancing professional competence and value recognized. So intelligence is important. So you want to have the healthcare transformation, cross-disciplinary cooperation. Another I think important is internalization. So you want to set up a low-carbon healthcare. We need a green environment, advanced net zero emission and green energy waste reduction. I think the social impact also important. So we practice equality for the barrier-free healthcare, and also we created social values through the public welfare commitment. I think integrity is also quite important. We prudent stepwise actual governance to strengthen the strategy areas to expand service capacity. So, for example, I think there are several critical issues in public health and clinical care delivery. And so we pick up 3 important issues first. I think cardiogenic sudden death is quite important around the world. So it created the early warning system. So we realize that over 80% of sudden deaths are associated with cardiovascular disease. So later we'll talk about this issue. Another is the mammography image quality assessment system. We have the same ranking in our hospital. The breast cancer ranking second in our hospital also is the first ranking in Taiwan in the patient with women patient. Another is the endotracheal tube alert system. I think the endotracheal tube is quite important for the patient in the ICU. So, but actually the prevalence of endotracheal tube dislodgement is about 76.7%, and more than 50% of patients will experience endotracheal tube dislodgement, and then they need reintubation within 48 hours. So it may be leading a mortality about 50%. So cardiovascular disease is widespread across the global and leading the cause of sudden death in several cases. So I think especially the patient has all-cause has about 17.8% of mortality rate, and among approximately 7 million people die this disease per year. So we create build up the cardiogenic sudden death risk warning system. So we use an AI database to perform the deep learning on the hospital-based large-scale ECG database and also clinical data to integrate together. We estimated the deep learning neural network model for the sudden cardiac death prediction. So we have the data from the cardiac arrest group and also the non-cardiac arrest group together. The data they have using the AI real-time and for the medical imaging system, then we can create the sudden cardiac death risk prediction. So this is available for the general patient and also for the public. And also you can use it for the high-risk patient. So another is, I mentioned about the important mammography image quality. I think breast cancer is a quite important cancer among the Taiwan and also other countries. And I think the international medical evidence mammography can detect breast lump and abnormal calcification in early stage. But actually, they have some problem right now. The quality of mammograph image directly affects the accuracy of diagnosis reports. And some studies that mention that suboptimal image can reduce the breast cancer detection rate from 84% to down to 66%. So the high quality image is essential to ensure the effectiveness of breast cancer screen. Because right now, Taiwan has 5 cancer already nationwide screen project, including the breast cancer, colorectal cancer, cervical cancer, and also hepatoma. And then also we have a low dose CT screening for high-risk patients, maybe develop the lung cancer also in Taiwan. Since this year, we have another cancer we are launched in Taiwan for the gastric cancer screen project nationwide. This is a cost covered by the government. So this is an example here. I think the positional image technique can affect the breast cancer detection rate. For example, here, some post-breast tissue and capture there, and multiple obstruction here, like this chin obstruction, or maybe low breast tissue obstruction by skin folder. Here is a blue image, so the overlapping breast tissue can well prevent accurate interpretation of the data, for example, calcification of the mass. Sometimes large and deep skin folds will affect the interpretation like this. So I think a good screening program should combine with a good mammography for the breast cancer. So we developed the automatic mammography image quality review system. So this real-time breast image can assist the radiologist to detect the real lesion in the mammography. So the real-time is an automatic image quality inspection system. So can assist the radiologist also for the improperly positioned burnous or insufficient compression. And also is a professional development, is an assessment tool for training outcome of new or trainee staff. Also, we have set up the long-term tracking of individual radiography image quality performance within our institution. We can also provide analytic report to support the design of personalized education and also training. We know that it's a busy day for a doctor also in Taiwan. For endotracheal tube, I see lots of staff, also nurse, to work about that. After that, it's the most important issue in the ICU is the position endotracheal tube. So traditional, if you want to have a good monitor endotracheal tube, you have the handover during the different shifts. You have confirmed by the X-ray, also by the manpower to auscultation of the right position. But actually, the current problem is abnormal bending or kinking of the endotracheal tube will affect the good position endotracheal tube position. So current its limitation here is external marking cannot ensure the accurate position. Also, it lack objective and precise assessment, and also lack real-time monitor and feedback for the ICU doctor and also the nurse. So this is another current clinical challenge in Taiwan's doctor. So the doctor is too busy, very busy. So a busy workload will unable to properly review the X-ray image, even take the X-ray, but maybe 7 hours later, they can see the X-ray. And also the professional subject judgment. Some medical personnel have inconsistent, even after the training, inconsistent interpretation of the position endotracheal tube. So these are examples here. The real-time display of endotracheal tube or tracheostomy tube position in relation to the currently. So we found the 3,200 image sample for training. So the example here, this is no endotracheal tube. Here endotracheal position is good, appropriate. But this is the alarm. Endotracheal tube position need attention, or it is very dangerous. Inappropriate endotracheal tube, maybe 1 hour. So we want to minimize the interpretation difference among the physician and improve the efficiency in verify the endotracheal tube position. So I think it's quite important cross-industry collaboration to join the hand to create a low-carbon healthcare environment. So the next step, we have the AI power, miniature, the lighter. So we want to lighter hardware like this one. So we have all the alarm system to put in the hardware for assistant our staff or nurse in clinical practice. So another is our hospital want to break in the environment limitation, also suitable for a diverse application scenario. So you want to from the primary healthcare to the mobile healthcare system, the health screen center, and also remote area. I think even in the Taiwan, but we have some area, rural area is difficult to get all the medical assistance up to date. So our hospital have a cross-industry collaboration to work together to build up a low-carbon healthcare environment. For example, there, so we want to set an AI performance workstation in our hospital to have a lightweight hardware. So from this, we can reduce the transportation between the patient and their family to have the carbon emission here, and also the lightweight hardware have carbon emission there. So have also the decrease of the healthcare cost, then the round trip timing for the patient. So the Kaohsiung Medical University healthcare system, we want to operation transformation, performance optimization in our healthcare system. So we funded the T-Sharp project in Taiwan. We have created several certificates from our government and the TFDA. So we also joined the responding center from the government for the next generation digital health platform and the high-tech computing. So we have gathered funding from our board of trustees. So we want to set up using the NVIDIA to contract advanced computing power facility over 100-fold using for the future prospect. So we was the only medical institution in southern Taiwan to twice to achieve the full smart hospital certification. We have 4 excellent certification and this is the result of the certificate from the Taiwan that we are 4-item hospital, the most excellent award in these years. So we want to have running the AI and project also. We are also win the NHQA National Healthcare Quality Award. So I think the ICU is a quite important unity in each hospital. So we want to create a smarter ICU in our hospital. So there we will ensure the medical decision support for family using the ICU station smart board, and also we have the ICU bedside care board for our staff in the clinical practice. So it is the example for the smart ICU bedside care blackboard. So from the blackboard, you can see that the pipeline listing, the check inspection and list of operation, the recent chest X-ray. Also, we can have inspection report and what kind of antibiotics information for this patient, and also a hand drawing remark area. They are here. Also, we can have a severe index smart component with the respiratory information, also the body fluid in out and situation for this patient. So it's a visualized station smart board. So we have built up the several developed 6 functions. There's a homepage there, a bulletin board, scheduling information, and the care team information. Also the contact number and the firefighting group here. So every day we can have all the data here. So the staff will quite easy to have all the data when the patient situation right now. So I think that is an important issue also in Taiwan. The shortage of manpower, especially of nurse. So we create an AI-assisted nursing narrative document. We know that realize that the traditional, the nurse will create a document a lot of time. It helps review all the data of the patient. For example, from all the order from the doctor. So right now, we just using the AI to have the document, maybe from the 30 minutes to 3 minutes. So another is AI-assisted shift handover nursing shift system also already in our hospital. So traditional, the handover should be the doctor and the nurse. The doctor and nurse is quite busy in a hospital. So we can have the handover system online, but they can put the data together to finalize this handover in our hospital. So it will reduce the caregivers' workload. Also, I think a large medical center like Taipei Veterinary General Hospital is the same. The bed is so crowded. So we need a system to predict which kind of patient can be discharged safely on the next day to have the bed available for the next patient. So we create a probability of discharge 24 hours later by AI. So we can prediction is a predict screen presentation here, and we know that patient can discharge within 2 hours, 24 hours, or maybe the potential discharge within 24 hours. The patient cannot discharge within 24 hours. So it's quite important for the operation of the whole hospital system. And this is developed by our team. I think for the patient, because I'm a colorectal surgeon, the most important issue for the patient with colorectal cancer is creating of the stoma. It's quite important. You know, some patients in Taiwan don't want to do a stoma. So we have the prediction system. We put all the data from different models set up here, so we can predict the patient how the possibility of the stoma can be created, because we have a data of possibility of leakage for this patient. So it's important. I can inform the patient the percentage of leakage from the colorectal surgery, especially for the rectal cancer. And this is a very, I think, it's a quite interesting issue here, because it's ED. Emergency department is also quite busy. So we have early warning system for high-risk patients in ED. So in there, you can have our medical staff to detect the risk of unintended deterioration of the patient, or maybe a complication of patient, or even the cause of the patient death. So for emergency patient, assessment will be conducted every 10 minutes for our patient. So the high-risk patient can be identified by clicking on the high-risk patient alert and from the emergency system interface. So this is the risk score here for our patient, and then we can use for our ED department. And we also, for the development of the AI already, we will apply for the approval of TFDA, and this emerging bowel obstruction. We know that the bowel obstruction is a different situation. Some kind need an operation, sometimes you just need a conservative treatment only. So this system can assist our doctor, our surgeon to decide if he needs an operation or not. So I think can really assist our doctor in our hospital, because to make the right decision for our patient. Sometimes the operation is not necessary, but sometimes it's quite important. And this is we set up right now in a hospital is a patient-centered personal AI platform. It's for the whole hospital, even the administration section and the old hospital section in our hospital. We call that the KMUH Genius. So it is the AI system we create by ourselves. You know, if you're using the ChatGPT, your data will input in the whole world. But I think some of the data is quite confidential. It cannot be uploaded to the ChatGPT or the OpenAI. So I think it's quite important we have create our AI system to chat our hospital to ChatGPT. So the data cannot be leaked out to the world. So because the privacy of the patient is also quite important, so we create that. So every department, so we have the patient-centered personal AI platform. We call that the KMUH Genius. So different department can use that. For example, laboratory and also hospital administration section can use that. Using the data to create your document at one time. So for example here, this is infection control Q&A. So we can get data integration to structure and strong infection control policy, SOP, and the protected guidance document into a vector database. So it can ask here, how to for the prevention for a disease. We using like a Q&A, a chat box. So you can quicker search and also reduce the number of calls, improve execution efficient and accuracy in our system. So the system integrates to the HIS system already in our hospital. This is an AI-assisted precision pointer for a patient. I think the medical education is quite important also in the hospital because we are university hospital. So it needs a lot of workload for our mentor. So this system is collecting all the data for the student. The data have lots of, our student or mentor student have lots of report, but we can collect the report at one time to create a system to evaluate the performance of our student. Because right now we don't realize that the competent-based education is quite important. So we can realize all the data for our student, also the reduce workload for our mentor. And this is the focus on nursing documentation, just I mentioned in previous. So step one, you can let the generate AI recommendation for a few possible health problems. Then you can select by the caregiver. The system will automatically generate a follow-up content for the folks record based on the select health question, so that can answer the question online as real time. This is we call that a Kuma gateway for the AI office. Because, for example, you want to create a document, so you can use the AI to create a document in with our own KMUH ChatGPT system. So sometimes, lots of doctors did not realize the new drug, new medication in our hospital. So traditionally, you make a phone call to the different department for the right answer. So right now, it's just keeping the keyword here. You can have all the data at the real time. So you don't have the extra other department to assist me. You just have the data on your computer. So you can have a benefit of quicker search, also alternating medicine recommendation and a precision answer. I think another also important next step maybe in Taiwan is telemedicine. I said telemedicine, we realized that during the pandemic COVID-19, the telemedicine is set up already in Taiwan. But I think the next step is how do we run the telemedicine, and also elder care is also important issue. So our hospital has set up a 24-hour remote intelligent health care management in our hospital already. Since year 2008 in southern Taiwan, we have 24-hour telehealth care service provided comprehensive intelligent health management without closing time. So we have post-discharge care, chronic disease health management, also family health management, and also in-home health management. We know right at this moment, our government promotes a hospital at home. But when the patient go home, a lot of questions may be raised by the patient. So if you have a 24-hour health care system, will assist the government to complete the job of the program of the hospital at home. So we have the proposal project from the government, the health and welfare technique to integrate the care advanced experience since year 2018. So we have e-health intelligent health management system. We have all the database with a rural area in 3 districts near our hospital. We set up the smart care and interactive APP. For example, during the pandemic, COVID-19 pandemic timing, we're using the GIS geographic information system. It's just like a map here. We can realize which kind of patient did not have the vaccine, which kind of patient need the injection or follow the hepatitis B or C. So we are also using 5G telemedicine in Kaohsiung City, not just Kaohsiung, our hospital based on Kaohsiung, but we also Pingtung and other Taitung County using this telemedicine. Also, it's quite important for the rural healthcare system in Taoyuan area. So we have lots of achievement for the smart rural healthcare. We have a award from the government here. So we want to have telemedicine clinical zero distance healthcare for rural area. Also, we have assistant KMUH emerging teleconsultation for assisted hospital here. A lot of hospital, we have cooperation with a lot of hospital. So we are our own long-term care development roadmap in our hospital and also other long-term care system. And we have 24-hour smart monitor system development in the hospital for our patient. So the smart healthcare and long-term care integration through the collaboration model will be in the future also in Taiwan. We have this. I think the government had a long-term care 3 point in the future. We have will implement that also in a hospital. So this AI prediction model already, and AI model prediction accuracy already. So chronic disease prediction model already there. So hospital alone is important policy from the government. So we will provide that for our patient. And the vision for the future will be not just the medicine, we have to provide the health for the suboptimal health patient or health patient long-term care. We will integrate together. So this is the final slide. I think thank you for every guest attention. Thank you so much.